Welcome back to the Bryan Devore Connection. I'm your host, Bryan Devore. What are the 5 keys to successful care management? Well, here to talk to us about those 5 keys and how important they are is my good friend, Lylene, and she's going to talk all about what she does and care management as well. Lylene, thank you so much for joining me today.
Thank you for having me, Bryan.
My pleasure. We've talked about this for a while, and
Yes.
I've known you for a number of years, but this is the first time we're sitting down and actually having this discussion, and we're going to get the information out to people too. Tell us about yourself and your background, how you got into the world of senior care.
Oh, definitely. So I have a medical background, and my training is in nursing and skilled nursing and CNA and LVN. So I've had quite a bit of experience in the healthcare field. I started off my career in call center, running large healthcare call centers where we would provide advice to individuals over the phone. But when call centers went away, I realized that I needed to switch careers. So I went from being a director to being a receptionist in a skilled nursing facility. And that's how I got my foot in the door to the senior care world. And being in skilled nursing, I realized right away that there was a need for seniors and their families to understand how senior care works. You can't just go online and Google, how do I help my mom, and get the answers that you need. So I started providing free advice and advocacy service to low income and individuals within our community.
That's fantastic.
Thank you.
And so when we talked the other day about what we're going to talk about, you were really focused on the 5 keys to what services you provide, which I think is super important. And the first one we'll talk about is important documents. What does that look like? What does that mean?
So when I go in to take care of somebody that needs the care management, that's one of the first things we're looking at to make sure that they have all the important documents that they need to move forward through their journey. As we all grow older, there's certain documents that you need. For example, an advance directive, very important. Power of attorney, so on and so forth. So we go and we look at all of those documents to figure out what they need. Maybe they need to make some changes on the documentation as well. Maybe the power of attorney is not available anymore. And one thing that everyone forgets about is the POST, the physician's signature on a pink sheet of paper that you should have on your refrigerator to let the emergency technicians that come out to your house, the EMTs, to know if you are do not resuscitate and what you would like done. That also goes with you to the hospital. So we're also looking to make sure that you have the POST in place as well.
Yeah, so I mean that's a great place to start because a lot of people probably who you work with, who you're first starting with them, they probably don't have those documents in place, or like you said, a POA that you don't even want to be POA anymore, and that doesn't help them at all.
Right, that's totally true. And there may be some additional documentation that we want to gather, whether it's funeral arrangements or end-of-life arrangements that they need to make, and bank accounts and passwords and different things like that. So very important to have all that together for your family.
For sure. Number 2 is insurance. Talk about that.
Oh, definitely. Well, with insurance, a lot of people don't realize that you may want to have straight Medicare instead of being on an Advantage program or an HMO. This allows individuals to have physicians to visit in their home and have their primary care physician come out and see them. So that's one of the things that we would be looking at is what Medicare plan do they have? Do they qualify for Medi-Cal? Is it time to look at and prepare for needing Medi-Cal? And Medi-Cal is the state-funded insurance. It's called Medicaid in other states, but here in California it's called Medi-Cal. We find that most seniors that need long-term care and are over 65 would qualify for the Medi-Cal benefits. And with those Medi-Cal benefits, you get things like in-home supportive services, the assisted living waiver program. You can start working with PACE, for example. And so that's very important. That's something that we look at. And if I need to bring in a broker to make those changes, I'll bring in one of my partners in the industry that can help with figuring out the insurance.
Yeah, that's great. It's such a tangled web, then people don't understand it, because it's so complicated. So they have to have a professional who can help them really navigate it. The other thing that can be a tangled web is their home. You do a safety assessment. So let's talk about what that looks like.
Yes. So with the safety assessment, I'm going into the home and making sure that there aren't rugs that they can trip on, that they have bars in the bathroom where they need them, whether it's in the shower, they may need a ramp. So I'm taking a look at all the different things, maybe moving things from that are up high to down lower, and making some modifications in the home. So I can make those recommendations, and then from there, I would provide them with a durable medical equipment company that could come in and provide those additional services for handicap, ramps. I'm just trying to think of all the
Yeah,
things. There's so many things that come across, but we take a look at that. It's very much individualized, and we also like to look at that before someone falls and goes into the hospital and goes to skilled nursing, so that we're prepared when that happens. And I'm also able to I have resources in the community where I'm able to get wheelchairs, hospital beds, and other durable medical equipment that they may need while they wait for Medicare to cover those expenses.
Got it. And then you mentioned, if people fall and so forth, and that's like the number one cause of injury and death for seniors. But then also it introduces doctors and doctors' visits and appointments. So that's the fourth thing is appointments that you're able to help, and med management too.
Definitely. I come from a unique perspective. Not only have I been educating families in the industry, in the senior healthcare world for over 15 years, but I also had an experience with my late husband who was very ill. And so I got to go through these things myself. And so I have, I don't just have sympathy, I have empathy. Like I understand what's going on a level that a lot of people don't. And so
it makes a big difference.
Yeah, it really does.
And the fifth key is when people cannot stay at home anymore, you do the assessment and what have you, where it gets to that point where they need some additional services, placement.
Well, definitely placement and home care. So we look at, is there a possibility that you can stay in the home? And that's what most people want to stay in their home. They don't want to go to assisted living. They don't want to go to a board and care. They want to stay in the home where it feels familiar and it feels safe. And so we look at home care as an option as well, using some of the resources in the community to provide the home care. But there does come a time when a person needs to move into assisted living, when they need that higher level of care and constant supervision. So then I would refer to a placement company to help them find the right fit for them. Again, we would be looking at the financial piece of it as well, and going back to the ALW waiver or what other options may be out there for those that are low income. And I just want to throw in there too that with LB Senior Healthcare Solutions, that is a paid service, but I also provide free advice and advocacy service for low income. And that's, I work with Qualicare Home Care. I'm the Director of New Business Development. And part of that is our 360 approach, where we help anyone no matter what. So we do provide that free advice and advocacy service, whether you use our company or not, we will provide that. And so that's something that I provide as well. So
that's pretty powerful. I mean, you really provide that holistic approach for anyone who needs the services, because people just don't understand it. They don't know how to navigate the process.
Exactly.
To have you as an advocate and hold their hand and guide them through the process, it's life-saving.
Right. And again, I've had the experience personally with family members doing the in-home supportive services, becoming an IHSS worker. And so I get it on a different level. I'm able to give advice that others may not have had that experience to be able to give to the seniors and their families on how to move forward with that. Also, I have experience and quite a bit of knowledge with the veterans. So the VA Homemaker Program, the Aid and Attendance, there's several veteran programs out there that a lot of veterans don't even know about.
Yeah.
And so sharing that information and finding where we can get the funds to assist with the care is really my goal, and to help people feel at ease. I will tell you things, and I'll tell the families and the seniors, I will tell you things that they won't tell you at skilled nursing, at the hospital. I'm going to be honest with you. I'm going to let you know what your rights are. And so that's been really helpful for a lot of families.
Oh, I'm sure. I mean, you are the #1 advocate for them, and you've been a staple in the industry for years, and I have valued what you do. And the information for your company is on screen, so people can learn about your company. Your website's right there, so people, or your email address, they can contact you for more information.
Absolutely.
Lylene, thank you for what you do in the industry and for the
you.
seniors in San Diego.
Thank you so much for having me today. It's been a pleasure.
Yeah, me too.